Foot X-ray labeled safe, normal foot X-ray. Normal foot X-ray. While foot X-rays are considered safe, there is a small risk associated with radiation exposure. X-ray technicians will only use the minimum amount of radiation necessary to give the best possible image. It's important to be aware of your health history, including pregnancy. This will make the experience easier for your child, who can be calmed by explaining the process. It may also be helpful to have your foot scanned before the procedure. X-rays are the most basic investigation of orthopedic problems. Normal foot X-ray. The image is black and white, with dense structures, bones, appearing white and soft body tissues, feet, skin, and muscles, appearing darker. The images are captured by a technician who works in an X-ray laboratory or in your physician's office. A foot X-ray may consist of 3 images: an anterior, a posterior, and a lateral view. An X-ray of the foot is an image made by a small amount of radiation. The X-ray machine sends a beam through the foot and records the image on a special film or computer screen. The images show the bones and soft tissues of the foot. The tarsal bones, ankle bones, are well defined, as are the metatarsals, front end of the foot. The first toe sesamoid bone is also present. A foot X-ray is a basic investigation of orthopedic conditions. Normal foot X-ray. A physician will order X-rays of the foot when symptoms indicate an underlying medical problem. These images can help the doctor pinpoint the exact location of the problem. The procedure can take up to 15 minutes, but the actual exposure to radiation is usually less than a second. For example, anteroposterior and lateral views are common on a foot X-ray. A foot X-ray uses a small amount of radiation to make the image. An X-ray machine shoots a beam of radiation through the foot and records the image on a computer screen or special film. An oblique X-ray can also show the navicular bone. However, an oblique X-ray can be used to detect a variety of different problems. An oblique X-ray is a common diagnostic test. Normal foot X-ray. A foot X-ray is used to evaluate fractures in the foot. The image is typically black and white. The underlying bones of the foot are white while soft tissues are dark. An oblique view is a common type of foot X-ray. The lateral view is a lateral view of the feet. An oblique view is a common type of X-ray, while an anteroposterior view shows the lateral view. The oblique view is the most common type of X-ray. Both images are useful for diagnosis. A patient's doctor will determine if there are any fractures in the foot. A physician may also order a foot X-ray for other reasons. An oblique X-ray allows for better visualization of the phalanges in the interphalangeal joint. The navicular bone can be more easily seen in an oblique view. During the procedure, the foot X-ray may take up to 15 minutes. The exposure to radiation is extremely small. A lateral oblique X-ray will take a few minutes. During the oblique view, the second metatarsal should be aligned with the intermediate cuneiform. This oblique view should be used to determine whether the second metatarsal is in alignment with the lateral cuneiform. In addition, the oblique view will help the radiologist differentiate between the third and fourth metatarsals. During the oblique view, a well-defined subchondral lesion has a 50% chance of progressing to focal cartilage loss. The lateral phalangeal view requires that the foot is positioned laterally. Normal foot X-ray. The toes should be flexed and extended. The lateral phalangeal view is important in determining whether the toes are fractured. This image should also be labeled. It is important to understand the importance of radiographs for evaluating the foot in children. This information can assist the doctor in deciding what treatment options are appropriate for the patient. The forefoot is the easiest part of the foot to examine. It is easy to see a forefoot fracture if the patient is pronated by 15 degrees. In order to properly assess the talus, the oblique view is required to identify the oblique fracture. A lateral view is helpful for assessing the phalangeal joints. The oblique view is an important tool for detecting a calcaneus. Normal foot X-ray. Normal foot Xray. Normal foot Xray.